Hello, America, and welcome to Vibrant Living, where we bring the experts into your living room to help unlock the secrets to the fountain of youth, to help you feel better, to live longer, and to have a more vibrant life. Today's guest is Dr. Guy Gross from New Horizons Dental Care in Salina, Kansas, where he is using cutting-edge techniques and technology to replace missing teeth with dental implants. We sent our camera crew to Salina, Kansas to catch up with Dr. Gross and his team. Take a look.
I'm Dr. Guy Gross. I'm the clinical director of New Horizons Dental, and we serve patients all across the state of Kansas. My wife, Dr. Kate, and I have worked together for our entire careers. In fact, we went to dental school together. We have 3 children, 2 boys and a girl. My personal passion is in coaching youth sports. So for both of my boys, I coach both of their teams in football, basketball, and baseball. Our goal from day one at New Horizons has been to build something special that really changes people's perception of how dental care should be, taking away all the things that cause the fears. I think what they find unique about us is that we really do listen. No matter what their dental needs are, our objective is to take care of them right here as a dental team, as a group of doctors that serve them under the same philosophy. Giving people something that allows them to enjoy the relationships that they build when they come in here. And it also means that they don't have to go to other offices to get treatment done. We try to serve them all under one roof.
Here at New Horizons Dental Care, we see patients every day that haven't been to the dentist in years, sometimes decades, and some of them are really embarrassed about the state of their mouth. When someone comes to us like that and they're so overwhelmed and they don't know what to do, we're going to provide you with several different choices so that you can make that choice and that you can be the person that determines what you want to do with your own mouth. Something we do every single day here is place dental implants. They're just a great way to replace one tooth, multiple teeth, or if you're missing all of your teeth, a way to support dentures so that they fit nice and tight. We love it because it gives people that confidence back and the function. So, if you haven't been able to eat steak or corn on the cob, dental implants can give you that back again. It's a wonderful gift, and we love being able to provide that service to our patients.
The most rewarding thing we can do is end up with patients walking out of here saying, I got my smile back. I'm able to eat the foods that I was really missing. I'm back to where I'm enjoying meals with friends, meals with families, or the confidence of smile. I also see people, really up in their careers, where they're able to get a better job because they have the confidence to do so now, and they felt like their smile was holding them back.
Please welcome to the Vibrant Living set, Dr. Guy Gross. Guy, thanks for being here.
Absolutely, my pleasure. I'm happy to be here with the opportunity to share.
Awesome, very good. So for people who don't know you or don't know your practice, tell me a little bit about your practice and what kind of procedures do you guys offer?
We have a design around it where we think all the dentistry under one roof, thinking from very young children all the way to the other end of the spectrum and everything in between, from orthodontics to sedation, your bread and butter dentistry like fillings and crowns and bridges, and then of course my passion is really lies in the dental implants and the reconstruction of teeth that have become badly broken or missing. We've formulated a team of doctors that are wonderful, absolutely a joy to work with, and wonderful and amazing hygienists that treat the total health of a patient, so that it's not just about cleanings and things like that. It's about your overall health, and there's more and more reasons why that's so critical. And really we endeavor to bring a full treatment spectrum to our patients, so they're not having to be referred out for this or sent somewhere else for that. And a lot of times for our patients, when they're getting referred to specialists, they would be going hundreds of miles of driving to do that. And we've endeavored to make that be, we are your home. Come to us, we'll take care of you.
And you got a very big team here, and it looks like you guys have a lot of fun at your office.
We have fun, yeah. It's a great group. We start our days off early every day, and we set the tone for having wonderful days and really serving our patients in a way that hopefully is exceptional. And you know, that's our goal. And we do have fun. We decided we all spend a lot of time together. We need to enjoy it and have a great time.
One thing, as we were talking on the phone before the show, which I thought was really amazing, is that you guys do a lot to give back. And locally, let's talk about that first. Tell me about some of the things you do locally to give back to the community.
So locally as a team, we've made a lot of commitments to utilizing our practice as a vessel through which we can give and do good is the way we talk about it. And so when we're doing that, we've used our whitening programs and a variety of things to serve our patients, to raise money for children's charities. Our particular favorite in Salina is AmBucks, which we give to children with disabilities. We go to the Mission of Mercy projects around the state and do dentistry to help people, you know, who don't have access. And then my personal mission, as an example, is that I coach kids. I have the opportunity to coach 2 teams each season in football, basketball, and baseball. So, wow. You know, that's my passion, is to help kids through sports. I teach them the things about life that sometimes sports are a great way to, again, a vessel through which I can teach that.
I talk to a lot of dentists who practice dentistry. I talk to a lot of dentists who teach dentistry, but you somehow do both.
I've been wonderfully blessed that over the years I've worked to develop techniques that are surrounding minimally invasive implant technology that I guess is worth doctors to travel to Salina and learn. It's not necessarily the easiest place in the world to get to, especially, you know, for these docs that have come from California and New York and Florida and even in the British Virgin Islands and clear the northernmost city in Canada. We've had people come to Salina to learn dental implant, minimally invasive technology and techniques from me, and it's just extremely humbling to know that I can have that impact through things that I've seen as just really I developed because I felt like it was a better way to serve patients.
Very good. You do the bread and butter dentistry, like you said earlier, but people come to you that have specific issues. What is the typical patient coming to you day in, day out, and what are some of their concerns?
Yeah, so most of the patients that come to me personally, you know, are getting to the point where quite often they, on some level or another, are becoming crippled dentally. So when I mentioned earlier, you know, whether it's missing teeth, whether it's loose dentures, painful teeth that are broken, or a broken down bite, they've oftentimes lost their ability to chew and function. They've lost their confidence in their smile. There's a multitude of things that impact them, and it ends up being personal impacts. It ends up being professional impacts at times. You know, so it's a lot of those different things that really has happened, and sometimes it's a slow, gradual process that they almost didn't see coming, and then all of a sudden they realize, gosh, you know, I'm sort of painted into a corner here, and then other times, you know, it's a more dramatic event. Something just broke, and they, you know, and they need a solution. I had a wonderful lady in just the other day, and we were talking after she had finished a lot of her treatments, and we were reflecting back on where we started. And when she had come to me, she had been this wonderful woman, raising children, going in, serving in public office, very active in her community. And as her dental condition deteriorated, she got to this point of, you know, feeling like she didn't want to leave the house anymore. Yeah. She was, you know, she had given up her service projects that she was doing. She was not going out in the community, even for things with her friends, her closest friends. And then, you know, this dreaded fear of even having her spouse see her without her teeth and things like that. And so, yeah, and you know, where she ended up with some gaps and some discolorations and things, and just knowing that she was in a bad place. And so we looked back after we had finished this, and she's like, "Oh my goodness, I'm back." That was really what she said. "I'm back. I'm ready." You know, like I'm doing stuff again that I used to do that brought me lots of joy. And that's just one example of somebody like that. You know, it's not always physical pain. It's oftentimes the emotional pain that gets to people more.
My dentist of 40 years told me recently that he couldn't do anything else for me. And the alternative was to have false teeth. My 91-year-old mother suffered with false teeth for 21 years. I decided that I did not want to live that way. I had such bad teeth that I couldn't chew. They were painful all the time. I found New Horizon Dental, and I chose to get started right away. For the first time in years and years, I've been able to chew meat. I love my implants. I love eating again because I don't have to worry about chewing in front of people if I go out to dinner.
Now, you also talked about being able to chew, being able to eat.
Yeah.
Patients come to you and they're in pain, they can't chew, they can't eat. How does that affect them?
We see a lot of this, and chewing, you know, I find that people are amazingly adaptive. They're adaptable. They can get used to a lot of stuff, and sometimes things happen so gradually they almost just kind of get worn into a place. But when they really look at it, what they've gone to doing is they're compromising on their nutrition a lot of times, because I always say it doesn't take teeth to eat donuts. You can get those bad boys down either
Milkshakes,
right,
or
milkshakes,
ice cream, or all the good unhealthy things.
The good unhealthy stuff that is possible to consume without teeth. The top 5 that people come to me and say, it's steaks. You know, Midwest, we like our steaks. Carrots, apples, nuts, and corn on the cob. You know, patients, like they'll go, you know, they'll find themselves shying away from going to dinner with friends because maybe they've got a partial denture, you know, one of the removable ones.
The ones that come in and out really easily.
All the hardware and everything, and so, you know, maybe it's loose when they eat, so food's getting underneath of it or whatever. Then they're having to get up in the middle of dinner, go clean it out, come back, and then they're done eating, you know, or they're fearing that stuff's going to fall out, or that they've got stuff stuck and they don't know it, but everybody else can see it, and so they quit going. So socially, I mean, I look at it as meals, holidays with, you know, friends and family are a huge part of our lives.
It really
is. It's
is.
part of the culture, right? And so if you lose that ability to really even go, you know, how's that affect you? You know, when you it's almost like being, you know, I find people oftentimes have ended up in a almost depressed state of being, and they're not finding the things, being able to do the things that brought them joy.
It's almost a sense of hopelessness.
Yeah.
For something so
Completely.
little as your smile, when people who have their teeth, they really take that for granted.
Yes.
The fact that I don't have to think about what I want to eat, I just throw it in and chew it down. But for people who are in a loose denture, or they're in pain because they can't eat, this is something they're dealing with all the time.
All the time.
My name is Robin, and I'm a trucker, and I'm a patient for New Horizons Dental Care. I was very embarrassed to even try to smile. I smiled with my mouth closed. I didn't feel like I should even be talking, just was ashamed to even smile. And it got to me one day when my grandson said, "What's wrong with your teeth?" I wanted to be more confident in myself, and I just wanted to be me, because it wasn't me. They went through it step by step, give me options. I chose what I wanted, and now that I got my new fixed teeth, I can eat just anything. Apples, steak, corn on the cob, anything. He said, "Wow, Grandpa, you got new teeth." And it made me feel really good. So I just wish I would have done it sooner.
What do we got here? This seems like something that you see quite a bit. This reminds me of my grandma or my grandpa.
Yes. You know, it's, I deal with this a lot. And now when people come to my office, a lot of times these teeth aren't actually still in the glass, but they're in their purse or their pocket. So people that have teeth, but they take them out to eat, which doesn't make sense, right? So I look at it like, well, what the heck's going on there? Well, you know, So at night, they're taking them out, they're in the jar, they get to a point where they're either tolerating them or they despise them, sort of, and you know, something in between that spectrum. And so you get these teeth that are moving around. So, I mean, you think about these formed pieces of acrylic, essentially what dentures are. This is not a technology that supports people's lives anymore as well as it could. Most people that are happy with their dentures usually are they're compromising in some way or another.
They're putting up with it.
Yeah, because it's essentially a piece of acrylic. It's not attached to anything. If you get really good at it, you can train your muscles, your tongue, your cheeks, your lips to try to hold it. But a lower denture has nothing to sit on, no real saddle effect, if you will. Sure. An upper denture can get a little better suction and fit, but it covers the roof of your mouth, so you lose some of your taste. More stuff in there. For people with sensitive gag reflexes, it can become quite miserable.
Let's take you through the next patient here. Tell me about this patient. Looks like we've got some serious problems going on.
You know, he's a great example of somebody who had just sort of this gradual deterioration, challenges that cropped up over time through breakage of teeth, you know, patchwork this, patchwork that over the years to kind of fill this and try to hold things together. And it's like, eventually you can only put so many patches on a tire before you're in trouble going down the highway, right? And he got to me at a point where the initial problem we were solving was perceived to be mainly just some missing teeth in the back. And so we started with the project of rebuilding those, but we got to really discussing his overall goals. And it was more than that. It was his bite. It was some of the extra wear and tear, the discoloration, the crowding, the rotations, just the pure breakage that was happening even on his front teeth. And you can see it there. And so we took him through a process that started with implants and you know, ended up being quite a complex situation that we solved. And you know, it's something that I'm so thankful that he trusted me to do for him.
Amazing. Yeah. Now, this transformation is amazing, and we're going to go ahead and pop it on the screen here, but this is the same guy, but this is what you do with him. Can you share with us real quick, what did you guys do here for Jim?
So what we essentially did was we utilized implants to rebuild what was missing and in some cases replace what had broken beyond repair. And then we, in addition to that, did porcelain restorative work to rebuild his bite into an appropriate position so that we could bring the joints, the muscles, and the teeth back into a harmony that would allow them to not have these forces that would be, you know, too much for the teeth to bear. Okay. So we rebuilt it with porcelain, and you can see we can get a great result with porcelain. And wow. You know, if you see Jim, you wouldn't necessarily know that he's had this done. I mean, we want it to be a very naturally aesthetic transformation so that, you know, people don't necessarily say, wow, you know, those sure looks like you had something done. I mean,
I love your veneers.
Yeah, we don't want them to say that necessarily. We want them to say, man, your smile looks great.
Our camera crew had a chance to sit down with Jim in the office of Dr. Guy Gross and team to hear his story. You got to check this out. Take a look.
My name is Jim Gableman. I'll be 80 in June. I'm a patient here at New Horizons. I'd lost a lot of teeth, and I had some bad teeth. It's hard to eat. If you can only chew on about 2 opposing teeth, you can't eat a whole lot. And so what you find yourself doing is cutting small bites and doing one chew and swallow. But it is tremendous. I can sit there and eat almonds, all kinds of nuts I want. I can chew my steak until it just dissolved. I mean, it's great. So the eating is tremendous. I'd recommend this for anybody. It's made a great difference in me. There was no pain at all, not from the very start all the way through the end. Never had any trouble with it. I never think much about it, but I do have a pretty good smile now. You know, it used to have gaps here and there, but that hasn't been a great big part of my life. I'm in the funeral business, so external appearance does make a difference. And so I feel a whole lot better about working with people now because I know that I do have a good smile with a lot of teeth.
Tell me about this gentleman.
Yeah, so, you know, Justin came to me really, again, sort of behind the 8 ball on some things where, You know, he wasn't sure, what he was going to do. So I call these are your crossroads moments in your dental life, if you will. You know, can I keep my teeth? Can I save what I have? Do I need to start over? You know, which obviously means you're taking teeth out, all of them oftentimes, to start over. You know, and we went through a process of really discussing his goals. As you can see, he's a young guy. He was ready to really undertake whatever made the most sense, and so we talked through the different options. You know, do you want teeth that stay in place? Are you willing to have teeth that come in and out? You know, we even talked through items such as budget and all of that, and we came around to really deciding on a plan to rebuild everything that we could rebuild of his natural teeth, to preserve that, because that is the shortest distance from A to Z, is to keep what you have and just make it better rather than starting over. And so we kept what we could, we rebuilt what we needed to with dental implants, and got him back to where his mouth is essentially as good as new.
Oh, my teeth were hurting, constantly hurting. My gums were swollen from, food debris, inside my teeth. And I had quite a few of them replaced. And it was a mess. And didn't want to live like that anymore. I didn't want the conventional dentures like my brother has. They lay in a bowl all the day long, So I decided to turn it around and come here and get it taken care of, and they did. And these people, they actually sat down and explained it to me, and I knew it wasn't going to happen like they have on the commercials in one day. I already knew that. And so I told them that straight up front, because it just doesn't work that way. Anything worth having, it takes time. Dr. Guy and his people that work for him are great, and they treat you like you're part of the family here. I feel so much better. I can eat better. I can eat better than what I had with my original teeth. Pretzels, peanuts, apples. I'm from Washington State, and I love my apples. You can afford it. Personally, I don't make a lot of money. I'm a painter, I'm a cook, and, but you can afford it. I had it done on my birthday. I started this process on my birthday, my 57th birthday. No regrets. Nope.
Amazing. I want to show you the after here. And the first thing I notice that jumps out at me is not just how amazing the teeth look, but this guy is smiling bigger than, I don't think he could smile any bigger. Does this happen a lot when someone comes in and they get this fixed with the implants and get a new beautiful smile? Yeah. Do you see a lot of change just in their countenance?
It's a wonderful thing, because we realize now all of a sudden a patient starts to almost get some momentum going back in a positive direction. When I say these deteriorations start to happen, and now we stem that tide and we turn it back in the other direction, all of a sudden they're smiling, and the people around them are always like, you seem happier, and guess what? When you seem happy and you are happy, you get more happiness back, right? And so you get this momentum going where now healthy choices start to become a more common thing, rather than feeling like, oh, what's the point, And now people are doing things to eat healthier. Again, they're back able to eat the healthy foods rather than getting by on, not the good stuff.
Donuts and shakes and ice cream.
Exactly. And so we get them back going in the right direction, eating healthy foods again. A lot of times their social life becomes more robust again. Their work life, I don't know how many times I've heard patients say, I need to have a career change, and my smile is literally holding me back.
So you're saying that a transformation like this isn't just something that builds confidence, but it literally can change someone's income earning potential, job promotions. That confidence they get can help them with their career. That's really amazing.
Over the last 15 years, I've been able to serve, hundreds, if not thousands, of patients with dental implants.
Just like this, thousands and thousands of people.
Yeah, everything from needing one tooth replaced because they've lost it or broke it or whatever, all the way to really rebuilding their entire mouth with dental implants. And, you know, so other people have done it. They've survived.
Sure, yeah.
They've loved to tell about it most often at the end of it. And it is a judgment-free zone because, you know, none of that matters to us near so much as where we're going.
I want to go over this next one here. This is, I think, out of all the dozens and dozens of cases you sent us to look through, this is one I thought was just amazing, the transformation here. Give us a quick story on who this patient is and what was their concern.
What we're dealing with here is situations of, you know, the patchwork that I talked about, things that have been sort of done here, there, and everywhere, never a real contiguous plan to his dental care.
Everything kind of looks different. And
different colors, different things that are at varying stages of wearing out, or, you know, there's even some decay and just difficulty in maintaining where he was at. And so, you know, he got to a point where we made some decisions about really just starting over and rebuilding with a new plan, and so we did that. We went through that process, spent the time together to work until he had an implant supported option at the end. So he has all new teeth that are all staying in place, and they're supported by implants now, but nobody else would ever know it.
Amazing.
Yeah.
The transformation here of this patient, again, just the first thing I noticed is the countenance change. I mean, this guy is happy and excited, and a lot of that's not just from the cosmetic side, but the fact that, you know, like you said, it's fixed in there with implants. Now he can eat what he wants, and he can go out and enjoy life again.
That's right.
So again, a patient like James who comes in feeling the sense of hopelessness, all that patchwork, ashamed of his smile, something like this, total life transformation.
Right, because a lot of times they're in physical dental pain in addition to all the emotional things that you mentioned, and to the point of not enjoying just how they feel, dealing with, you know, when your body's fighting infections, it's very difficult to feel good.
Sure.
So yeah, I mean, he really kind of got a renewed lease on life with that, and it's so fun to see him be able to do that.
Truly amazing.
Yeah.
That's all the time we have for today. I feel like we could talk about this forever, but this has been some really amazing information. I really am grateful that you came on the show today. If you're sitting at home and something here has inspired you and you're ready to make a change, I want to recommend Dr. Guy Gross and his team down at New Horizons Dental Care. Give them a call. Set up a no-cost, you were saying no cost, no obligation implant consultation to see if you'd be a good candidate. And start living a more vibrant life. Dr. Gross, thanks for being here.
Absolutely, my pleasure. Thank you.